Hi, boys. Okay, we are 3 days post-op. Had a hernia surgery last Friday, and it the surgery itself went well. It's now the recovery that's a little interesting. So when we talked with the anesthesiologist, he explained that with brain lesions, neurological issues, and things like that, there can definitely be some complications with the symptoms that I currently have, and some exasperation. I hate this word. It can make the symptoms I currently have worse. So, um, with the symptoms that I currently have, so we're talking about the walking and the balance, the weakness, some of the skin issues with the tingling and sensitivity to heat and cold. All of those things are going to be affected. With the balance issues, the biggest thing is right after surgery, which you guys kind of saw. I was stumbling around. I had to use my cane. That's all stuff that is technically normal in my situation. So it wasn't something that I was shocked by. It was something I was actually prepared for, which is why I brought my cane with me to the hospital for the procedure. And when the anesthesiologist was explaining what was supposed to happen with anesthesia and my symptoms, he was very excited that I thought of that. So it's not just the walking and the balance issues. There's some right side, because everything's on my right, facial heaviness, which is a symptom of a stroke. However, I'm not having a stroke. So it feels like my face is drooping to me. But obviously, as you can see, there is no drooping. But I don't have a headache. I don't have a migraine. I don't have any kind of tightness anywhere. It doesn't feel different in any other aspect other than to myself. So that's actually a symptom, which is kind of a weird, scary symptom, if you ask me. And the other parts of it would be to keep an eye out for that headache, migraine, chest tightness, because that could lead to a stroke at this point. So I am keeping an eye on it. The the right side, sorry guys, the words are a lot worse with this anesthesia issue. But the right side weakness is definitely worse. I have had a really hard time opening easy things, and in not just opening things, but I've had a lot of muscle spasms. So there's and on both sides, not just the right side for this side, but it's definitely noticeable that, there's changes that have happened. And the anesthesiologist said to be aware that it could be a week, and we're coming up on 3 days. So if it's longer than a week, I was instructed to talk to my primary care doctor. So that's going to be something that we are going to take care of, because obviously we don't want any kind of different issues to develop in ways that should not have developed, simply because I did not take care of it with my primary care doctor after the surgery. So I just want you guys to know that there is a lot more to having a neurological issue and having a simple procedure than, just, oh, keep an eye out for, the bruising and the swelling and oozing and things like that after a procedure. I still have to watch out for all that normal stuff, but I also have all of this other side that I have to be aware of also and pay attention to, because like right now it's very hard for me to develop sentences, find words, and just make sure that my thought process is complete. It's very frustrating. I know this whole process hasn't been easy on anybody, Dad included, because he has to go to work and he wants to be able to stay home and take care of me and Ennis and you guys. And because he has to work, he can't do that. So that's very frustrating. That would be frustrating for anybody. I can't imagine if the role was reversed how I would be feeling right now. And I all I can say is the appreciation and love that I have for him is enormous. And I really want you guys to understand that the love and respect and the things that he does for me, he would do for you also. So just know that, okay? I can't keep processing. I'm sorry. This anesthesia is really getting to my speech and it's kind of getting to me, but I love you guys.